Hello, we're talking about the pathophysiology of heart failure. First, to set our time, we're going to talk about the background, talk about increased load, then increased afterload, pump dysfunction, as well as increased metabolic demand as the causes of heart failure. So first we define heart failure, which is a state in which the cardiac output cannot meet the demands to maintain metabolism and growth. It can occur with reduced cardiac output or with increased metabolic demand. Cardiac output is the stroke volume times the heart rate. So increased afterload. Afterload is the volume of blood in the ventricle end of diastole, and increased afterload occurs with left-right shunt. Then also with tricuspid regurgitation or with mitral regurgitation. So afterload is the resistance against which ventricles pump, and it increased on the right side resistant pulmonary hypertension or pulmonary stenosis. Then it is also increased on the left side with alteration of the aortic stenosis or any left ventricular outflow tract obstruction. And pump dysfunction can occur with cardiomyopathies, which can be either dilated cardiopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, non-compaction, or arrhythmogenic right ventricular dysplasia. Then we talk of myocarditis, which is inflammation and arrhythmogenic causes. Also, there is a post-surgical ventricular dysfunction, which can occur after bypass or effects of surgery. Then we talk of a dysfunctional myocardium, which can be found in patients that have congenital heart disease. So increased metabolic rate can occur with thyrotoxicosis. And then reduced preload is also a cause of heart failure because the cardiac output cannot be adequate with the reduced preload, and this occurs with constrictive pericarditis. Okay, it can also occur with cardiac tamponade from tension, pneumothorax, hemothorax, or a pleural effusion. Then we talk of reduced oxygen carrying capacity with anemia. Just go back a bit. So we talk of the renin-angiotensin and the sympathetic response, which is a positive sympathetic response increases contractility and the heart rate. Then the negative effects of the sympathetic response is that it also increases afterload, and there is reduced renal blood flow, which also activates the renin-angiotensin aldosterone system. Then the endogenous response from the heart, the atria will secrete atria natriuretic peptide and brain natriuretic peptide. So this is acted by reducing the afterload by causing vasodilation, and they also reduce preload by causing diuresis. Then the Starling compensation, this is increased strength of contraction of muscle contraction up to a certain limit. Then it decompensates. Okay, so this occurs increase in volume of increase in preload. The Starling compensation occurs, but there is a limit